contaminated surfaces of the mask. Discard the mask in a closed bin immediately after use.
I will take the vaccine because building defenses against COVID-19 is a team effort, and we are all a key part of that defense.
I definitely will be taking the vaccine when it's my turn.
I will be taking the vaccine as it is an important tool in the fight against the pandemic.
It is important for me to vaccinate to ensure that if I do become infected with the disease, it can prevent hospitalization. In addition, it also helps with herd immunity.
I will take the vaccine to protect myself, my loved ones, my clients, my co-workers, my community.
St. Kitts and Nevis, why do we need to vaccinate? Kenisha? So we can jab COVID-19 away.
Today we're at the Newtown Health Center where we've had the official launch of the COVID-19 vaccination program. We are so pleased to have had quite a cross-section of individuals who were represented here today and taking the vaccine. We had members of the cabinet, we had persons from the medical fraternity, doctors and nurses alike, and we've had quite a number of other persons from the clergy, from immigration, from police, you name it, they were all here to take their first dose of the AstraZeneca COVID-19 vaccine. And so we all got our COVID-19 vaccination card to indicate that we would have taken our first dose of the vaccine. Once we come back in 10 weeks, we will have our second dose, and then once we got that second dose, then the cards would be stamped at the front with the Ministry of Health stamp, and that is to finalize that you did receive both doses of the COVID-19 vaccine. A reminder that the vaccine helps us to ensure that persons do not have severe illness or death. And so we're encouraging persons to step forward and take the vaccine. Get all the facts that you need to get. The Ministry of Health provides all of the information. The facts on the vaccine are on the covid19.gov.kn website. And so we're asking you and urging each and everyone to come out and get your vaccine. Look at the information, get all the information that you need, whatever makes you comfortable. But I can assure you that we have all taken it so far, and I'm feeling good. My arm is good. It was a vaccine, and so I'm excited about that. And so I'm looking forward to my second dose to say I'm completely vaccinated for COVID-19. And as the science continues to evolve, I'm sure we'll find more information and more benefits as to why you should take the COVID-19 vaccine. But for now, I know that since I've been vaccinated, I lower the risk of me getting severe illness or death from COVID-19. I also know that I'm protecting myself, my family, and my community. So I'm asking everyone, get the facts and then get the vax. Today was an example that it is safe, and we urge each and everyone, when it's your turn and your stage come around, to get vaccinated. As we progress, we will provide more information as to the next stage and who will be next. And so look out for that information from the Ministry of Health. We'll keep you informed, we'll keep you updated, we'll let you know how many persons have been vaccinated, and we'll let you know when it's your turn that you can make your appointment calling 311 or any of the health centers. So go ahead, get your vaccination. Today we're at the Newtown Health Center where we've had the official launch of the COVID-19 vaccination program. We are so pleased to have had quite a cross-section of individuals who were represented here today and taking the vaccine. We had members of the cabinet, we had persons from the medical fraternity, doctors and nurses alike, and we've had quite a number of other persons from the clergy, from immigration, from police, you name it, they were all here to take their first dose of the AstraZeneca COVID-19 vaccine. And so we all got our COVID-19 vaccination card to indicate that we would have taken our first dose of the vaccine. Once we come back in 10 weeks, we will have our second dose, and then once we got that second dose, then the cards would be stamped at the front with the Ministry of Health stamp, and that is to finalize that you did receive both doses of the COVID-19 vaccine. A reminder that the vaccine helps us to ensure that persons
is on.
Good afternoon, and I welcome you to the National Emergency Operations Center COVID-19 weekly briefing for the 3rd of March 2021. I am Les Roy Williams. I thank you very much for joining us for today's briefing. As usual, joining us means that you are paying attention to what is happening with respect to the COVID-19 pandemic and its management here in the Federation of St. Kitts and Nevis. We continue to bring you update in terms of what is happening. At present, we are at the stage of vaccinations. Vaccines have arrived, and we are trying to see how many people can come forward to be vaccinated. It is extremely important to get vaccinated to build your immunity against the COVID-19 COVID-19 virus. Of course, there's a lot of misinformation and disinformation out there. There has been a very big campaign globally with misinformation and disinformation, and unfortunately, quite a number of us have fallen into the trap of the misinformation and disinformation with respect to the COVID-19 vaccine. We realize that a lot of the misinformation and disinformation originated in developed countries, in UK and the United States and so on. But what we are seeing is that in the UK and in North America, people are lining up in multitudes to get the vaccine. Millions are being vaccinated in the UK and in the United States. Some of us here in the Caribbean, including in St. Kitts and Nevis, we have drank the Kool-Aid, buying into the misinformation and disinformation, because their economies are going to get back on track, while our economies will remain behind if we do not get vaccinated. And that is the long and short of the story. Are we going to be duped in not taking the vaccine, while the first world countries, the developed countries, they are taking the vaccine? They have fed us these lies. They have fed us these lies, and we have believed them, while they have gone ahead believing in the science, lining up in thousands and millions, taking the vaccine. They're even hoarding vaccines because they want to ensure that they have enough vaccines for their populations to be vaccinated. We, of course, we do not have sufficient vaccines as yet. We're still trying to get more vaccines. Let us be vaccinated. I am pleading, I have taken the vaccine, and I am pleading that we take the vaccine. It's the only way that we are going to get back to any point of normalcy in this country. And the thing about it is that when we want to travel to these developed countries, they're going to ask us, they want to see that you have been vaccinated, your immunization passport. We have a choice. I would like to invite Mr. Mahesh Narayani of Sun Island Close, he's the general manager, to make a donation to the National COVID-19 Task Force of some masks. Mr. Narayani.
Gracias. Okay. These are the anti-COVID masks, right? And they are printed as well. Okay. So let's speak to the mic. Yes, these are anti-COVID masks, and they are also water repellent. They are antimicrobial. They have hydrotech technology. So as we just heard, right, that we have to follow the science, and this is with science. This is a very highly sophisticated mask, basically, right? This is not simply another water mask or another cloth mask or anything like that. This is very, very highly sophisticated. So the wearer will really enjoy wearing it, right, and get a lot of benefit from it.
Thank you.
Okay.
Thank you, sir. Thank you. Again, we want to thank Mr. Narayani from Sun Island Clothing for these antimicrobial masks that he has donated to the National COVID-19 Task Force, where it basically says the name of the National COVID-19 Task Force, and it has said that I got vaccinated. I guess Mr. Narayani was waiting until the COVID-19 Task Force complete their vaccination. Thank you again for your corporate partnership.
Thank you very much, Mr. Narayani. Of course, as you can see, we still have good-hearted people, people who are coming forward and donating to the cause of COVID-19 here in the Federation of St. Kitts and Nevis. Thank you very much for your donation. I now invite Superintendent Cromwell Henry, member of the National COVID-19 Task Force, to give us the law report. Superintendent.
Thank you, Mr. Williams. And President, good afternoon to all listening to this broadcast by whatever means. As we enter a new phase in our quest to return our Federation to as near pre-COVID normal as possible, pre-COVID-19 normal as possible, I will use some of my time this afternoon to lend support to this effort. Over the last 12 months, we have been advocating and enforcing the non-pharmaceutical measures that prevents the spread of the coronavirus. And by now we are all very well aware of these measures, but I will repeat them for what it's worth. There are the wearing of face masks while in public, the maintaining of social and physical distancing, avoiding crowds and crowded places, and good hand hygiene and sanitization practices. As we now go into this new phase of vaccination, as another measure of control and prevention of the spread of the virus, we want you to be mindful that the vaccine does not replace the non-pharmaceutical measures, at least not yet. So while we encourage you to take the vaccine, like I did, we remind you that you should continue to adhere to all the measures prescribed by the law. I want to thank the Football Association and the football-loving fans for their understanding and cooperation with the measures to restrict spectators in stadium during league matches. The COVID-19 regulation limits the number of persons who are permitted to gather in indoor and outdoor facilities. The maximum number of persons permitted in an indoor event is 100 and 150 for outdoor events, provided the space is sufficient to facilitate physical distancing of 30 feet per square feet per person or 6 feet between persons. We continue to see funerals and other religious activities not complying with the COVID-19 protocols. These events bring people together and are just as risky as any other event. We appeal to all to give more regard to your health and to adhere to the protocols. With respect to funerals, the Commissioner of Police has asked that these be registered in our events or online events management application at www.police.kn so that we can keep track of them. In closing, I would like to encourage all, in addition to adhering to the non-pharmaceutical measures, to get the vaccine whenever it's available to you. Thank you.
Thank you, Superintendent Henry. I now invite our Medical Chief of Staff, Dr. Cameron Wilkinson, to make a presentation. Dr. Wilkinson.
Thank you very much, Leslie. Today, someone asked me to give them one reason why they should vaccinate. I'm going to use my time here today to give you 10 reasons why you should vaccinate. 1, it is free. Yes, the COVID-19 vaccine is 100% free. There are no financial barriers to you getting the vaccination. Yes, it comes at a cost, but not to you. All you have to do is show up and get it. 2, it is highly effective. The vaccine is way more effective than the flu vaccine that a number of persons take each year that averages between 40 to 60%. This vaccine has an efficacy of over 82%. And when you get vaccinated, it protects you from getting seriously ill. So it's the joy of gaining immunity without the risk of getting really ill or even having what's called long-haul COVID. So it's a win-win. 3, it saves lives. More than 7,000 persons are dead in the Caribbean region. Over 500,000 are dead in the United States. And more than 2.5 million people are dead worldwide from COVID-19. Getting the vaccination is a sure path to your survival. 3, it is safe. It does not affect your cell's DNA. It does not give you COVID. It actually helps to boost your immune system so that you can fight the disease. Safety studies were done with COVID-19 vaccines in tens of thousands of persons before it came onto the market. And many millions have received this vaccine worldwide. And so the 55,000 persons that we have here, there are millions who went before you, and they have had very little side effects from this vaccination. 5, you protect those around you and the vulnerable. Being vaccinated helps prevent you from getting COVID-19, so you are less likely to spread the disease to others, especially the vulnerable. So if you have children, grandchildren, grandparents, or elderly persons around you, then that's a good reason for you to get vaccinated, because you will be not only protecting yourself, but protecting them. 6, you help to protect our health system. By ending this pandemic through vaccination, we release the pressure on the health system so we can dedicate our efforts, funds, and equipment to helping persons with non-communicable diseases. And these are still killing persons, and we need to keep a close focus on those other diseases. 7, it keeps your cash flow strong. As stated, getting vaccinated stops you from getting sick. If you are not sick, you can continue working and continue to bring needy income for your family. 8, it helps to protect future generations. Over the course of history, humanity has had to coexist with many debilitating and life-threatening diseases that are now rare due to childhood vaccination programs. Immunizing yourself against COVID-19 today will help to eradicate the virus and protect future generations, thereby allowing them to have a healthier and longer life. 9, it helps to prevent fake news spread. Research has shown that fake news spreads faster and much further than truthful information. Over the last few decades, conspiracy theories and misinformation have eroded public trust in vaccines, leading to the reemergence of diseases that were eradicated before. By following evidence-based guidance based on science, you are not only protecting yourself and your loved ones from COVID-19, but you're sending a strong message to those persons who are coming with fake news. And I'm happy that in just 8 days of us having this rollout, we've had over 2,000 persons who've stepped forward to take the vaccination. So that's a step closer towards herd immunity. And finally, it is the quickest way for us to get back to normal. No more masks, no more social distancing, safe travel, no quarantine, no more endless Zoom meetings, hugs with friends and family and grandma, parties, no caps on gatherings, wedding, church services and church services return to more normal, concerts, music festivals, sporting events, of course, once we eradicate the virus. And so those are 10 good reasons why you need to go and vaccinate. So don't hesitate, vaccinate.
Thank you very much, Dr. Wilkinson. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center Situation Report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my role to share with you the Health Emergency Operating Center's Situation Report for today, Wednesday, March the 3rd, 2021. As at today, the Federation would have reported a total of 41 confirmed cases of COVID-19. I want to share with you that 40 of these cases would have fully recovered. So at present, we only have one active case in our federation. And I want us to please note that the last case, the last imported case, was identified 18 days ago. Now, in terms of a quick overview of the COVID-19 status globally, at present, 114.3 million persons have been confirmed with this disease internationally, and over 2.5 million deaths have been reported globally. And this is as reported by the World Health Organization's COVID-19 dashboard. In the United States of America, 28.7 million persons would have been confirmed with COVID, and over 516,000 deaths would have been reported. That's deaths as a result of COVID-19. Now, in terms of the CARICOM member states, collectively, the islands would have reported a total of 109,764 confirmed cases and 2,431 deaths. This slide just gives you an idea as to what's happening in terms of the outbreak in our neighboring islands. So Antigua and Barbuda would have reported over 769 cases, Barbados over 3,000, St. Lucia over 3,500, St. Vincent and the Grenadines over 1,600, and Grenada 148. At present, we have students who would have returned for classes at the Ross University School of Veterinary Medicine. They are presently in quarantine. They would have come in a week ago. A total of 93 students would have completed the first week of their 14-day quarantine period. Between last year and present, over 9,872 persons have been tested for COVID-19 in the Federation, and only 41 of these results would have returned positive. So that gives us a positivity rate of 0.4%. In quarantine, we have a total of 5,798 persons. At present, I said we only have one active case, so that individual remains in isolation, and just underscoring that we would have had 40 cases recovered to date. Okay, so just an overview as to what's happening in terms of our national COVID-19 vaccination rollout. Now, in terms of access to the COVID-19 vaccines, St. Kitts and Nevis would have received a generous donation of 20,000 doses of the AstraZeneca Oxford vaccine just this past Monday morning. On February the 11th, we received a generous donation of 2,000 doses of the same vaccine from Dominica. Now, in terms of the COVAX facility, we have said repeatedly that the Federation would have signed on to this facility, and we are expecting a total of over 21,600 doses through this facility. But however, at present, we do not yet have a specific date, an expected time of arrival of this amount or allotment from or through the COVAX facility. But please note that access to the COVID-19 vaccine is crucial to curbing the spread of this pandemic. Okay, so the AstraZeneca Oxford vaccine is the vaccine that we are offering to our population, and this vaccine provides us 83% risk reduction in contracting symptomatic COVID-19. We are using the dosing schedule of 2 doses of this vaccine given 10 weeks apart. So the dosing schedule involves a 10-week interval between dose 1 and dose 2. We are targeting individuals over 18 years, so that's between 18 and 80 years. But please note, 80 is not a cut point. We are recommending that individuals who are over 80, that you go to your physician, your regular physician, be evaluated such that your physician can give you the nod of approval to proceed and take this vaccine. Now, this vaccine is quite effective against the UK variant, and it has a very good side effect profile. In other words, individuals who would have received this vaccine between last week and now, they would have only expressed minimal side effects. As a matter of fact, most have not complained of any side effects. The vaccine that we are offering was manufactured by the Serum Institute of India, and for me it was very reassuring to note that the Serum Institute of India manufactures over 90% of the vaccines that we have been using and continue to use in our federation. These are the vaccines that we give our children and have been giving our children, over the past 10, 20 years. So for me, that's very reassuring. Now, in terms of our rollout of our COVID-19 vaccination plan, now between last week Monday and last evening, yesterday, Tuesday, March the 2nd, we would have vaccinated a total of 1,356 persons in the Federation. But today alone, that's Wednesday, March the 3rd, we vaccinated 729 persons. And I'm happy to share that I am included in that 729 persons. So to date, we would have vaccinated 2,085 persons in our federation. In other words, we would have reached 6.3% of our target population just in a matter of 9 days. Yeah, so in 9 days, 6.3% of our target population, a total of 2,085 persons. Now, in terms of this vaccine, you know, more and more persons are coming forward and providing consent to receiving this vaccine. However, if you are experiencing a cold, respiratory tract infection, and you are having a fever, we're going to ask you to postpone vaccination. If you are pregnant or breastfeeding, we'll ask you to postpone also. Again, we are targeting persons over 18 years, and if perchance you have a history of severe or significant allergic reactions to any of the chemical you know, components of the vaccine, we would, you know, ask you not to take it, or this would be a contraindication to taking the vaccine. So, in order to access the vaccine, so if you're at home and you are listening and you're convinced and you're ready for the vaccine, all you have to do is go to the nearest health center, irrespective of the priority group. So ladies and gentlemen, this week, Monday, we would have received an additional 20,000 doses of the vaccine, and so we are no longer adhering to the priority groups as we explained last week. So irrespective of the priority group that you find yourself, once you are ready, once you are empowered with the information and you would have made an informed decision, all you need to do is go to the nearest health center to access the vaccine. You don't have to even call 311. Just go to the nearest health center to access the vaccine. And get your first dose, and you'll be given an appointment to come back in 10 weeks for the second dose. The health centers are the primary vaccination sites. So in St. Kitts last week, we would have started with 4 health centers. So that's Newtown, Bastille, Sandy Point, Tabernacle. Now, as of today, we rolled it out in Cayon, Molyneux, and St. Peter's. So Cayon, Molyneux, and St. Peter's Health Center, they were open and persons were able to access the COVID-19 vaccination at these sites. And within short order, in another day or two, we would add Old Road Health Center and St. Paul's Health Center, and then shortly thereafter, Sadler's and Dieppe Bay. In Nevis, you can access the vaccine at either of the 6 health centers. Now, what are some of the post-vaccine symptoms that persons are, sharing with us? Some complain of tenderness or pain at the injection site. Some said that, during the evening after receiving the vaccine, they felt cold or they experienced chills. Some had mild fever, which was relieved by paracetamol. Some complained of malaise or fatigue, body aches and pains, and or mild headache. So these are just some of the more common post-vaccine symptoms. The Ministry of Health, we have developed a comprehensive communication plan, and the aim is for us to empower our people, build trust, and generate demand for acceptance of the vaccine. So members of the Ministry of Health and the task force have been engaged in a number of have been hosting stakeholder meetings. So we've met with the police, Tomorrow, I think we are meeting with Immigration and Customs. This morning, I would have facilitated a very nice presentation with the entire Ministry of Finance. And so we are hosting these stakeholder meetings, giving persons an opportunity to have their questions answered, to have any misconceptions cleared up, such that we can empower persons to make informed decisions, create demand, and increase acceptance of this vaccine. Our goal is for adults to access the vaccine. So in other words, our aim is to vaccinate our adult population, which comprise 72.4% of our population based on the last census. However, ladies and gentlemen, as we vaccinate our people, we must continue the essential public health actions to suppress transmission and reduce mortality. Because at present, only 6.3% of our population have received the first dose. And so we have to continue the prevention and control measures, active surveillance, testing, the wearing of the face mask, physical distance, and adequate hand hygiene. We must continue these measures until we would have achieved herd immunity, until we would have vaccinated a significant proportion of our population. Get the facts, choose the vax. So ladies and gentlemen, I have every confidence in the safety and efficacy of the Oxford AstraZeneca vaccine. So this afternoon, I took my vaccine. I got my first jab. If you are interested in getting your first jab, we want you to get the facts, make an informed decision. And when you have chosen to go to the nearest health center, just a recommendation, dress appropriately. Wear short sleeves as I did, or sleeveless top. Go to the nearest health center. You will be asked to complete the pre-vaccination checklist. The nurse would help you in this regard, and get your first dose. Upon receipt of the first dose of the vaccine, you will be given your COVID-19 vaccination record card. And we are asking you to keep this safely, because chances are when things resume or approach normalcy and you start to travel, you may have to utilize and show this COVID-19 vaccine card. You'll also be given an appointment to return in 10 weeks. All right, and so this is just an idea as to the pre-vaccination checklist. Just some basic demographic data. You're going to have to provide us your name, your age, place of birth, your occupation, and some questions in terms of, what are the medical conditions that you have? Are you on any medication? Do you have any history of allergic reaction to any of the chemicals? Just some basic data. So it's very easy to complete. Within 5 minutes, I was able to complete my pre-vaccination checklist this afternoon. And then this just gives you a snapshot of the COVID-19 vaccination record card. The next slide. Yes, so this is a sample of the COVID-19 vaccination record card. And the next slide shows you that we are going to record the first dose, the type of vaccine, it's the Covishield, the manufacturer, the Serum Institute of India, the batch number, the date, and then the health professional who would have administered the vaccine will sign your card. When you come back in 10 weeks to get the second dose, the card will be filled out appropriately, and then we would affix the Ministry of Health stamp on the card, and then your card would be an official record of your receiving your full schedule of your COVID-19 vaccination. Hashtag our best shot. Ladies and gentlemen, this Oxford AstraZeneca vaccine is our best shot. our best shot at protecting ourselves, best shot at protecting our families, protecting our community, and rebuilding our economy. Hashtag COVID-19 vaccine is our best shot. I'm going to invite you now to look at a brief video that was recorded a few hours ago, just earlier this afternoon. Preparations to administer my first jab of the AstraZeneca Oxford vaccine. Her hands are sanitized. She's not wearing gloves. And this is an international standard. So during vaccination, what's required is that your hands be sanitized, thoroughly sanitized. Wearing of gloves is not indicated. It's only indicated if there is an open lesion on the individual or if the individual has a rash. So she's following the international standard in terms of sanitizing her hands and administering the vaccine. I'm not really afraid of needles, but I just don't like to be on the receiving end. I would prefer to give an injection, but not receive one. But she was rather patient with me this afternoon. I would have received my first jab of the AstraZeneca Oxford vaccine. A Band-Aid was applied, and so that's the end. I received my COVID-19 vaccination record card, and I was given a 10-week appointment when I'm to return to receive the second jab. And I thank you.
Thank you very much, Dr. Laws, and of course the evidence was presented that you actually took the vaccine. I remember that question that was asked when you were on Leadership Matters. I now invite the chair of the National COVID-19 Task Force and the National Disaster Coordinator at NEMA, Mr. Abdius Samuel, to make his presentation.
Good afternoon, Mr. Williams, and good afternoon, everyone. Thank you for joining us again on this NEOC weekly briefing. Today I just want to highlight a few things, including being vaccinated today and being administered the AstraZeneca vaccine along with the other colleagues from the National COVID-19 Task Force. Okay. So as I said before, today we would have witnessed the continued rollout of the vaccination program. And in this regard, I would have attended the vaccination process with my other colleagues, the remaining colleagues from the National COVID-19 Task Force, and also we saw a number of persons from the health sector. Again, as was previously stated, as you can see, it was a simple process, completed my form, went through my checklist, and then you will see that our colleagues, including Mr. Petty, our Permanent Secretary for National Security, everyone highlighting that I got my COVID-19 vaccine, and hopefully so should you. Now, the public awareness campaign which is aimed and geared towards ensuring that we advocate for and influence individuals to accept the vaccine continues with a heavy focus on the manufacturing sector. And what the public awareness campaign aims to do is to take the campaign to them at the manufacturing sector, to the different factories. We have been talking to them so that we can have support for this. So to the persons at the Carib Brewery, Jaro, Harosovo, and also Kajola, as well as Mr. Mahesh at Sun Island Clothing, Demerara Distillers, and others, the Ministry of Health will be reaching out to you very soon so that we can arrange these public awareness campaigns. It's very critical that we continue with this all-of-society approach. I also want to highlight that the work of the Ministry of Tourism and Tourism Authority, just today, they would have had a very important discussion with the tour operators and taxi operators who have received the travel approved seal. And there would have been 51 persons in attendance. And from my conversations with the CEO of St. Kitts Tourism Authority, Ms. Raquel Brown, everything would have been well. The information was well received, and we would have had persons who have already indicated their interest, over 20+ persons in the tourism sector, taxi operators and tour guide operators, who would have committed to accepting the vaccine. And I'm understanding that there are more. So all persons interested within the taxi, fraternity, tour guide operators, please contact Ms. Raquel Brown as she is trying to gather a comprehensive list so that we can have you vaccinated, as you are a critical sector. Another sector that I wish to highlight is the entertainment industry in St. Kitts and Nevis, which has been adversely affected and impacted by the COVID-19 pandemic. Now, for the past week alone, there were 107 events that were approved. And if we want to get this industry to the quote-unquote pre-COVID state, then it's going to take the all-of-society approach and the industry using all of its platform to carry the messages to all the followers, friends, and colleagues. We need to reach that threshold, and it's very important that we meet that threshold. So we are making an appeal to the entertainment industry to use their platform to advocate for vaccination and have individuals vaccinate. The National COVID-19 Task Force on yesterday, Tuesday, The second would have met with the Nevis Culturama Committee. Mr. Antonio Abonati Libod would have made a presentation, a very comprehensive presentation to the National COVID-19 Task Force on the safe hosting of Culturama using mainly a virtual platform. I must say that I have to commend the Nevis Culturama Committee for their preparedness in bringing a proposal forward as per how they can host such activities. And Mr. Abonati Libod ensured, but he actually committed to having the vaccine administered to him today. And as we can see on the screen, Mr. Abonati is proudly demonstrating that he got vaccinated. If we want to reach to that state of normalcy, again, we have to vaccinate. However, we must not let down our guards. Even before we started the vaccination program, we saw that the pharmaceutical measures that have been helping us have been somewhat not being adhered to. And it seems as if, the vaccination process has overshadowed these critical and important measures. We have to stay focused on ensuring that these measures are followed. We have to continue this fight. And in continuing this fight with the COVID-19, we have to develop the roadmap to recovery. It's very important that we reach this roadmap to recovery. And the National COVID-19 Task Force within the next few weeks will be working with a number of stakeholders within the National Disaster Management Framework to advise on a recovery roadmap so that we can return to that state of normalcy once we meet our threshold. So again, I want to encourage every citizen, resident of St. Kitts and Nevis, to go out there, get your jab. I took my AstraZeneca today. You can take yours tomorrow. Thank you.
Mr. Samuel, thank you very much. That brings us to the question and answer segment for today. And I only received one question, and that is from Von Radio in Nevis. And the question is, as it relates to taking the AstraZeneca vaccine, if someone perhaps decides not to take the second jab, is there anything in place to penalize that individual? If no, will there be in the future? Dr. Laws.
Very good question. The taking of the vaccine, Mr. Williams, is not mandatory, and so we would just educate the population that the full dosing schedule of the AstraZeneca Oxford vaccine is 2 doses, 10 weeks apart, so it's not complete until you would have returned for the second dose. And so the nurses would do what we always do in terms of vaccination. And so if your second dose is outstanding, we will give you reminders. We may even give you a visit at home just to encourage you to come in for your second dose.
Thank you, Dr. Laws, and that brings us to the end of our briefing for today. I want to thank all of you, Dr. Laws, Dr. Wilkinson, Mr. Samuel. I thank Mrs. Christmas Jacobs. I thank Mr. Nariani for his donation to the National COVID-19 Task Force. I thank ZIZ. I see that Mr. John James is back. That is good. He's out of quarantine. We thank Vesta and the communications team here. We thank all the data entry clerks that continue to work around the clock, the frontline workers, the compliance team, and so on, everybody who is working in terms of managing the COVID-19 pandemic here in St. Kitts and Nevis, I think that they deserve our commendation because the management team for COVID-19 has done a fantastic job. All around the world, people are wondering how it is that we have done so well. From developed countries, developing countries, big countries, small countries, Caribbean countries, Europe, North America, Asia, Africa, all over the world, they are wondering how it is that this little country of just about 104 square miles can be doing so well in the management of the COVID-19 pandemic. So everybody is playing their part. We continue to play our part in adhering to the protocols and the measures that have been put in place for our safety. So thank you very much. Next Wednesday we will be back with another COVID-19 meeting. Until then, take good care. I am Les Roy Williams.
Is on.